Just so everybody knows, we are recording this for folks that cannot make it today. And I am going to share my screen. I have a presentation. Before I do that, oh, Haley Buckheit, look at all these faces. I just wanted to kind of share a little bit about why we put this meeting together. There have been lots of questions from everyone in the field about what is this transition and what does it mean for me? And with the help of Jackie Hersom, we really felt like we needed to put together a time where everyone can meet. Annette Sear, look at you. And give you, so this presentation is like soup to nuts. It's got all the details about the law and the elements of the law. Some of you may have already heard this, so it's repetitive, but there are others here today that know that there's this transition going on, but don't really understand what it is or how it came to be. And so this presentation will have all of that information. What I would love for everyone to do is if you could just put your name and who you work for, where you're from in the chat, just so we can have a list of everyone that attended today. And please feel free, this is interactive. I want you to raise your hand, unmute, put questions in the chat so that we can answer your questions. We will also provide you with information on how to get a hold of us if you leave the meeting and think or obsess about the information and then have future questions that you want answered. You can get a hold of us. Okay, so I'm going to share my screen. Can everyone see that? Can someone just give me a verbal? Yep,
Yes.
great, thank you. I can't see all of you. Okay, so first of all, why are we transitioning early childhood special education services from what we currently know as CDS to the school districts? And so when we talk about this situation, we call all of the school districts SAUs. And then when we talk about child development services, obviously we're going to say CDS. So why? Why has this come about? I'm sure many of you have experienced some of the troubles that we've had in child development services. The biggest reason why that this isn't working, the current system isn't working, is that CDS does not, other than a few preschools, does not own or operate general education preschools. And so it's very much like you're trying to figure out special education services without a building, without a consistent provider or placement for those children. And so because of that, it significantly raises the administrative level of serving children to organization and coordination versus being able to have staff that are working with children hands-on. So once again, this seems to be the biggest reason is causing the current situation where we have unmet needs in the state right now. The other thing is that because of this, we have this situation where preschools are being developed to serve students with disabilities that are self-contained or more restrictive in nature because we don't have enough general education settings for children to attend in an inclusive environment. Another reason that we have is we have recently been audited by the federal government. So the Office of Special Education and Programs came last fall and did their audit with us. So just like we go in and monitor and audit school districts on their special education programming, we also audit CDS sites. where we go in and we look at records, we look at programming, we look at their procedures, their policies, etc. We knew that OSEP was coming. And we also knew that this was going to be an area that they were going to focus in on because of all of the press around CDS and its failure to provide early childhood special education services. So we already knew that, and we knew that we needed to have a solution to this problem to present to them. And so this is why this legislation was put forward to transition early childhood special education to the public schools. So the way this rolled out last year was it started with LD 345. And we always tell people we loved this LD number because it captured the age group that we work with. LD 345. And this was the act to transition child find and FAPE for eligible children from CDS to the school districts. It then rolled into what was called LD 2214, which became Public Law 2023 through the governor's supplemental budget. So what happened is LD 345 actually died on the floor. And so there was a misconception out in the community that this did not move forward. But what actually happened is it got rolled in, all of the language that was in LD 345 was rolled into LD 2214 in the governor's supplemental budget. I'm going to pause just for a second. Let me see, just check on the chat to see if there are any questions. Yes, the slide and the presentation will be shared with everyone. Any other questions at this time? No? Okay, I'll keep moving forward. So I'm going to go over the elements of the law. So the biggest one is transitioning FAPE, or free appropriate public education, for 3, 4, and 5-year-old students before they enter kindergarten with IEPs to the school districts. Every other state in the country, early childhood special education is embedded in the public schools. So Maine has been unique for many, many years, 30 or 40 years in the system. When it was developed, they separated out and served birth through age 5 through this quasi-state governmental agency called CDS, Child Development Services. And so essentially what we are doing is over the next 4 years, we have until July 2028 to transition all the school districts in Maine to take on ownership of child find and FAPE.
Yeah,
So
that's no, excuse me, sorry.
Did you have a question, Sarah?
No, a bunch of snow came off the roof. My husband wondered what happened. Sorry.
No problem. So also part of this law is that this can be done a variety of ways for school districts. One, they can take on this ownership, but they can also contract with their local CDS site, which in part of this law is shifting the local CDS sites to what we're calling a service and support hub. So basically, CDS could offer a variety of services that school districts may contract with them to provide. I'll talk a little bit more about that later in this presentation. The other part of element to this law is that we have all of the school districts who are joining. So we're currently in what we're calling cohort 1, and we are gearing up for cohort 2. All the school districts that participate complete a readiness plan. And what that does, it provides our team with information on areas of strength and then also areas of opportunity where we can provide some technical assistance or professional development. And we are collaborating, and I'll explain this as well in this presentation, we are collaborating with many agencies in the state, not just the Department of Education, to figure out this process. And one of them is the early learning team, which helps support public pre-K programming and community pre-K collaborations. So I'm going to go over a little bit about the funding, but this is really pertinent to the school districts and may not be of interest to you, but I just wanted to include it in the slide deck that the funding for this for school districts will be 100%. It's through the state. So it's currently, CDS is currently funded 100% through the state. So we are just transitioning that funding to the school districts. We have already developed a funding formula. It is very similar to the way schools are funded through their EPS model. It is an early childhood special education funding model that gives a per child allocation amount for school districts. We did have a revolving renovation fund, which if you are familiar with how public schools get new schools, they get put on a list for revolving renovations. So any sort of big type of like in the school districts, like renovating air quality, bathrooms, boilers, any type of those big kind of building wide pieces. We did have a 4 million pot of money for that. That's already been the process ended, and the awards have been given out. And then there's also a part of this element to the law is about supporting educators to get their 282B, and that is the special education teacher certification birth through age 5. And so most public schools have 282 certified teachers, either K through 8 or 7 through 12. But most schools don't necessarily have somebody who is 282B certified. So we're providing certification application and course reimbursement through a pathway project. Okay, so more elements to the law. As I said, we are transitioning the CDS sites to be a regional service and support hub. The other thing is that these sites will shift to the superintendent regions, not the current CDS regions. So that impacts some of our CDS sites, and then other CDS sites are not impacted. We are currently working on that realignment, and when that happens, everyone will be notified. So I don't have a date yet of when that realignment is. So what I would anticipate is for providers that you would get notified if your CDS site boundaries changed. You would be notified, like, now I'm just putting it out there. I don't know this for sure, but let's just say CDS Peds had different towns in that boundary. We would put out a notification letting everyone know what the new Peds site had for their catchment area. Also written into law is that the CDS system will have service offerings and also develop guiding principles for these regional service and support hubs. Also into this law was language about developing a parent advisory committee, which we have already had. For every site, we've had 1 meeting, and for some sites, we've had 2 meetings. We're right in the middle of our second round of parent advisory committee meetings. And really the focus of those parent advisory committee meetings is to seek input and feedback on child find and the provision of FAPE from parents. And so we have parents that sit on the committee, but then we've also developed a live link that has been pushed out to all parents that they can click on this link and fill out a form with any sort of question or concern about their child's services or anything. And then we have a whole system at the CDS state site and at each regional site on how we handle that information and then report it back to the Parent Advisory Committee. The other piece that's written into this law is that if there is any due process during the time that a child is in CDS or it's carried over into the school because of a lack of services in CDS or whatever, if it starts in CDS, then CDS continues to pay for that 100%. It's not the responsibility of the school district to absorb that if it's a carryover from when the child was in CDS. Okay, I already talked a little bit about the certification pathway that we have collaborated with the University of Maine to provide for educators and CDS staff. We also were tasked with providing information on the difference between Maine PERS and Social Security, and that really has gone away as the Windfall Act has been removed, and now staff that are in the Maine retirement system can also collect Social Security. So there was, when this law was being developed, there was concern that if staff wanted to, like say, leave CDS and go work for a school district, that they would be penalized because in CDS they fall under Social Security, and in a school district, a majority of the positions are under the Maine retirement system. But that kind of has been alleviated right now. As I said, there was the revolving renovation fund, and then this is a big one, and we haven't even really touched it at this point, but we're also tasked through this law to establish a centralized Maine care billing system for Part B, which is early childhood special education. As you can imagine, that is a huge task that we will be undertaking as well. So as I said before, we have a huge team at the state level working on building all of these policies and procedures to support.
For verification.
Oh, I'm going to mute that. Okay. So we have the commissioner's office. We actually have staff from the governor's office on our team. We have a whole data team because there is a new way to collect data now. And we also have federal reporting that we're required to do for this age range. As you can imagine, we are building the fiscal part so that school districts are receiving that allocation for the children that they are now serving. We are working very closely with the early learning team because they are our general education partners in this. And then certification, we are working with them knowing that one, we know that there's a shortage of teachers, and we don't want to make it more complicated for folks to get their 282 or 282B if they want to move into the field of special education. So we're working closely with certification as well. And then, of course, school facilities through that revolving renovation grant, but also part of what we've been able to do through cohort 1 and moving into cohort 2 is supporting school districts with building or enhancing their public pre-K classrooms to be adaptable and also supportive of all children attending. So that has looked like us going in and working with the school districts and really helping them build nice new classrooms if needed. So part of this is also working with the Department of Health and Human Services on finding where our collaborative partners are in the community. So we can locate and find and support school districts collaborating with local childcare facilities or family childcare programs in the community. So we have a whole team that's been developing all kinds of programs to help do that. It's part of our onboarding for cohort 1 and cohort 2 to locate and have collaborative conversations with their local programs. I'm going to stop there and just pause to see if there are questions that I can answer. I'm going to stop sharing if I can figure that out. Whoops. I can see everybody. Okay, it looks like there's lots of questions in the chat. I am going to try and go back to, looks like slides. Okay. So I'm at the question, can school districts contract with private preschools that support children with special needs? Absolutely, they can. And that's what I was just talking about, is that we are encouraging school districts to know who their community programs are. Through CDS, we have a format for that early childhood tuition agreement that Jackie Hersom is in charge of. And then through the school districts, that will look a little bit differently. That would be a local, somebody from the school district contracting with that childcare or a family childcare program to determine what that rate is and what the needs would be. The next question, and if I answer one of these questions and I didn't answer it correctly, please just like raise your hand or say, no, that's not what I meant. I want to make sure that I'm answering everyone's questions the way they intended. I do have a slide later on cohort 2, so don't worry, it will be in the presentation. That's cohort 2. So 282B is different from 282. So 282 is the certification, and it's K through grade 8 or it's grade 7 through 12 right now. And then there's 282B, which is birth through age 5. Was there a different question about that? I'm just making sure I'm answering that certification question. Okay, well, CDS providers in private special purpose preschools with 282, yes. So anybody working with age group birth through 5 should have a 282B. So if you don't have a 282B and you want to get a 282B, you can contact us and we can help you, point you in the right direction. I believe that these changes mean that families will not be asked to use their private health insurance to cover related services. All I can say about that is not all school districts are set up to bill Maine Care, and I don't know of any school district that bills private insurance right now. As I said, one of the elements in this law is that we do have to build a statewide Maine Care billing service for this age group. And I know that there has been talk about that including private insurance as well.
Tiffany has her hand raised.
Oh, sorry, Tiffany, I didn't see you.
Hi, thank you. The question about the 282B is that when we look up our staff certifications, and it doesn't say B, it says pre-K. And so we're just wanting confirmation that when you folks say 282B, it's the same thing as 282
Yep.
pre-K.
Yes.
Okay, great. Thanks so much.
Okay. So there's a question about how does this affect what is logged into sync? So I can share what this looks like for cohort 1 is that any provider here working with a cohort 1 school, probably Annette, you are, you just bill through they use Adori EDMS. So Annette, I would imagine, just goes in and logs in her service logs under a different system that way.
Yep. It's
Okay.
pretty similar. Just go in and put it in there under EDMS.
Yep. Yep. So there are a variety of IEP management systems for public schools, and it's local control. So that means each school district gets to choose which one they want to use. EDMS or Adori is like the big one in the state. I think it's like 70% of school districts in the state of Maine use that. Then there's one called GEM. There's one that's with Infinite Campus, and then there's one with Synergy. Those are the big ones. I'm hoping I answered that question, but if not, just let me know. Can the SAU contract with outside providers? Absolutely. So here's what we know. There are not enough providers in the state, okay? So I don't want anyone to think that they're going to lose their job because school districts are taking on this responsibility. We do not have enough providers. So absolutely, these school districts, if they are not hiring people in-house, they will be contracting with local providers. And so part of this process is, and we did this with cohort 1, is our CDS site, like Gail or Pam, the directors will, they don't want to lose their providers either, right? Because they still have students that they need to serve. So it's really working as a collaborative partner with the school district to see like, okay, do you have enough people in-house knowing that you're taking on X number of children? So we do this little walkthrough with them. We look at the IEPs, we look at the amount of services that are needed. Do they have enough in-house support? Do they want to hire additional staff? Do they want to contract? So it's very individualized to each school district. As you can imagine, we've had school districts that range from 0 children, right? One child, and then that child moved, so they didn't have any children, to districts that have 50 or more in cohort 1. So the conversations are very different amongst all of the SAUs that have taken on the responsibility this year. But yes, they can contract, and they will want to contract. Yes, so I think I'm answering the same question. They would contract with contracted providers. Annette, I know that you had already contracted with Holton prior, so there was already an established relationship moving forward. So if you don't have an established relationship with a district and you know that this is going to be impacting you once you see cohort 2, we will absolutely make those connections so that the school district knows that providers are out there and wanting to work, especially providers that are talented and love working with this age group. That's what we want. Is there a place for teletherapy providers as the restructuring continues? So we know that because of our lack of providers in the state, teletherapy is used throughout the state to provide therapies to children. We also know that it's probably not the most preferred method of providing therapies, but it is what it is for some children. And so actually we had just met with a school district prior to coming on to this meeting about their interest in joining cohort 2, and therapies was part of that conversation. So what if you couldn't hire a speech therapist? Would you contract with a teletherapist? What would that look like? What would you be able to shift staff around to support? Teletherapy might work better for a certain population of students. It might work best if it was in your pre-K program and you had e-helpers or a text there to help with that. So it's always working through those barriers that may come up for teletherapy. So the rates, yes, the rates, that's all local control. So we do not have any say over the contracting rates with local school districts. There was a question about our rates determined by the school district. Okay. There was a statement there about 282 pre, okay, Heidi, I think I answered that about 282 pre-K. Question about Head Start, SDI provider contracted through CDS. You work for Head Start. There is the question, is there any information on how this will all affect Head Start? I don't think it will affect Head Start at all because Head Start is one of our strongest community providers. So we know that Head Start has a very robust system for supporting children with disabilities, and that CDS partners with them to help support these children. And so when we're working with school districts, most school districts are already collaborating with Head Start. They might have some Head Start classrooms in their building. They might have a community partnership with a Head Start classroom. It's not been a heavy lift for our school districts that are in cohort 1 or thinking about being in cohort 2 because they already know who their Head Start program is if they have one in their community. So Linda, you asked again about 282B, the pre-K, 282 pre-K. Did we answer that for you? Yep. So if you have a 282 and you need to have a 282B, you can apply and you will get a conditional. And that's good for 3 years until you take the required coursework. And then you are a conditional 282B at that time, once you apply. No, so therapists fall under their own licensing. So 282 and 282B is just for special education teachers. There was a question if therapists needed a 282B. Okay, I think I answered the question about the outside provider rate. That is up to the local school district. I am contracting with CDS now at private preschools, but the child live in different towns and districts. How would that look in the future? So Jackie, I'm not quite sure if you want to elaborate on this. I don't want to answer it incorrectly. It could be that, and I'm not quite sure what you do for a service. So if you want to unmute or we can connect later, I can try and answer that for you.
Hi, Sandy. Sorry about
Oh.
that.
Oh, no problem.
I'm at the JCA in Portland, and some of the students live in Cape Elizabeth, some in South Portland, some in Portland, Falmouth, Cumberland, they're all over. We don't want 5 or 6 specially designed instruction teachers coming in. How would that work for me so that I can see all the children in the school? Would I contract with all different districts?
Yes, so this is an interesting question, and I'm going to try really hard not to get into the weeds. And I also want to let you know that this is not 100% been clarified on our end, but we are working on guidance on what or who or where school districts are responsible for serving children. Okay. So that will be coming out shortly. So we know that school districts are responsible for serving children who live and reside in their district, but we also know that children in this age group travel to different preschool programs outside their school district. So we are working on the guidance on that for schools. So
Okay.
unfortunately, I have to say stay tuned for further information on that.
Okay, thank you, Sandy.
Yep. Okay, so there's a question about the classroom teacher. Does the classroom teacher need a 282B? So if it is a general education preschool classroom, you do not need the 282. Remember, that's just for special education. So, but if it's a special purpose preschool, then that teacher would need a 282B. You could also have a 282B supervise ed techs that can serve children. And Jackie, I'm watching you nodding your head, so I'm making sure I'm telling the same information that you say. Okay. Okay, I'm reading a question about our Maine health providers have the capability to bill private insurance. Will we be allowed to continue billing Maine Care or private insurance directly? Or we would have to consult. So if you are serving a child that is in a cohort 1 or cohort 2 school, it is really up to that school district on whether they already bill Maine Care. Annette, I'm picking on you today. I'm sorry, but I just know you so well.
That's okay.
And are you filling out logs on EDMS for billing for Holton?
Yes.
Like your service logs?
Yep.
So Holton is our star school in cohort 1 because we did not make it a requirement that you have to bill Maine Care to join cohort 1. But Holton said, we're already billing for all of our other students for OT, PT, speech. So we're just going to continue on. We're going to add these children to the responsibility, just like any other speech, OT, PT working in the school district. And so that's the model that we have right now. They are the only school that is billing Maine Care. So if you are contracting with a district in the future, that would be part of your contract agreement, I would imagine, is whether you are responsible for billing or not. And is it really, it's not that heavy of a lift. It's probably just like entering logs into sync, right, Annette? Maybe
Yes,
even
it is. Yep. You just
Okay.
it's the same thing, basically. Just fill out your time. You've seen the kids and your goals and what you worked on, and then it automatically bills.
Yep. So Audrey, I hope that answered your question, but it's really unique to each school district on what they are deciding to do moving forward. Answered the question about rates. The rates are determined by the school district and are negotiated by the school district. I will be talking a little bit about the services in the Service and Support Hub in just a minute. And Nicole, we know who's in cohort 1 because we're working with them currently. We know most of the districts in cohort 2, but we do still have districts that are interested in joining, and so they may join. And when a school district joins the cohort is voluntary. So it's not like we tell them when they join. So remember, we have 260 something school districts in the state of Maine. We had 17 in the first cohort. Right now we're at 30 something. We anticipate cohort 3 and cohort 4 are going to be our big years. So I'm going to pause just a minute because I see that Trisha.
Hi, it's Elsa, but
Okay.
So I know you said the rates every time. I'm sorry to keep asking. So is it just for the people who are already contracted with CDS, or like I'm an itinerant teacher for CDS. I'm not contracted through, so my rates
Are
are
you a,
also determined.
are you a staff person at CDS?
Yes,
So this is just for contracted providers. So it would only be, once again, I'm going to pick on Annette. So Annette's a contracted provider. She contracts with multiple different school districts in CDS. So Holton happens to be in cohort 1. So she has a contract specifically through them. She also has a contract through CDS to work in Southern Aroostook and
Yeah.
probably in an office somewhere, right? Doing evals and such. Yeah. So she has a couple different hats that she wears, and she has multiple different contracts depending on which, if she's in a cohort school district or the children still under the CDS umbrella.
okay, so by the time, 2028 comes, I'll have to be contracted somewhere with some public school.
If you are a CDS employee, we are not saying that at all. What we are saying is that, and that's why the law was written the way it was written, to stand up these service and support hubs, is because we value you, we value your work. And there, as we said, there's not enough providers around. There will be work for everyone. And so
Perfect, thank you.
you could be in a CDS site that's standing up that as a service. And so you're at first step. So name a town in that area.
Lewiston, Auburn.
Lewiston, Auburn and Lisbon have
Yep.
decided to be in cohort 2. Lewiston hasn't yet.
Yep. So let's just play this out. So Auburn says to our CDS site, gosh, we need somebody to go and be an itinerant special education teacher at our local sites. Do you have somebody like that? And we would say, yes, we do. And they would pay CDS to provide that service, and you would be assigned what that looked like. Does that make
Okay,
sense?
that was the perfect example. Yes, thank you.
Yep, no problem. Please, if you need anything clarified, I will do my best to do that. I'm going to keep skimming through. I'm going to stop after the next question so I can go back to the presentation, because I'm looking at the time and I knew this was going to happen and I knew everyone was going to have a lot of questions. So as we get closer, I want you please to use the chat for questions. You will also have my email and Jennifer Hopkins. We didn't introduce her, but she is the transition coordinator for this transition, and she makes everything happen behind the scenes. And most of all, she's our direct contact person. The other person you can contact is Jackie Hersom. Most of you know Jackie and probably have her email. So reach out to one of us and we will get an answer for you if you have a question that we don't answer. Okay, so I'm going to answer one more question and go back to the slide deck. Okay, so as a private center, who would we receive information from regarding this as a transition occurs? You should hear from your CDS site first, and you may hear from your local school district if they have a need to contract with you. So they're given all of the information of the providers in the area. And so that's how it may happen. Definitely from CDS. And you will know once you see the cohort 2 list, whether you're in one of those school district areas. I encourage you, if you are in one of those areas, reach out to your local school district and say, hey, I've been contracting with CDS. This is what I provide. I have a high quality place, service, whatever it is. I'd love to talk to you about it. Okay, so I'm going to stop with the questions right now and go back to sharing. I'm going to probably quickly go through some of these slides. Okay. Can everyone see my screen again? Great. Okay. So I'm going to kind of skim through this. Just know that we have gone through a lot of initial work to get this transition up and running for cohort 1. And this is really the pilot year. This is the year that we are learning all about the systems of early childhood special education as it applies to this transition. The other thing is that we have a national expert. We have a former 619 or early childhood special education coordinator director from the state of Arizona. And she has been instrumental into helping us as a state learn how we need to proceed in order to support our school districts, our providers, our current CDS system, everyone involved. Okay. Already talked about the self-assessment and our fiscal and data teams. Once again, you'll get this presentation slide deck, but these are the schools in cohort 1. And so, like I said, we had 17. It ranged from schools up in Aroostook County all the way down to York County. And here are the school districts in cohort 2. And once again, this is as of today, at this moment, this is who we have. Like I said, we met with a school district. Yes, I've met with 2 this week. I have 1 more this week. So the other thing is that schools can technically rescind their interest up until a certain date. And that's basically when they sign on with us. So we could have some of these schools drop out as well. So you will get this list as well. So the service and support hubs. So what this looks like, and you know, this is one of the pieces of the plane that we're building as we fly it. And it's really been unique to each CDS site as we've been moving through cohort 1 about what do they actually have for resources. There are some sites that we know still have unmet needs. So those are the sites that probably don't have a lot of latitude to say to a school district, sure, I can share my speech therapist, or I have an itinerant teacher, or I have this service that I can share with you, because they're already maxed out. They already need more than they already have. And then there are some areas in the state where it was a little bit easier for us to have those conversations and say, you know, school district, what would help make you successful this first year? What can we do to help you? And then school district would say, oh, it would be great if you could take on all 3-year-olds. And then the director would have to say yes or no. And what do you mean by that? And what would that entail? Is it case management? Is it preschool services? Is it the itinerant model? As you can see, it can become very intricate in regards to the services provided. Sometimes it was a short-term fix. We had some school districts that were like, I've got a speech therapist, but she can't start until December. Can I share your speech therapist until then? And then we had to work out that. So really, when we talk about the service and support hubs, it is very individualized to each site as well as each school district. And we had quite a few school districts that took this on. And just so you know, one of the criteria for joining cohort 1 is you kind of had to have things together. You had to have like a pre-K program, and you had to have like, you couldn't go into this with a ton of lack of resources. And so a lot of the school districts are like, we're good. We think we've got this. We've got enough latitude within our own staff to figure this out. And if they needed to, they just hired new staff. There wasn't a need to engage in the service and support hub model. But as you can see from this list, it is, we're open to any conversation that a school district would have for a need that they might, you know, have out there. The biggest things that school districts are hesitant about when they come into a cohort or start learning about the cohort or transitioning is 3-year-olds, right? They kind of get 4-year-olds. They have them in their pre-Ks. They've been working with them for years. They get that. It's 3-year-olds. It's like, oh my God, a 3-year-old. It's like an alien coming in. They just don't know how to deal with it. And it's really not that different. I know that. But for them, it's scary to think that 3-year-olds are riding a bus and 3-year-olds are walking into our school and they're using our bathrooms. What do we do? So 3-year-olds and then the itinerant services, right? So schools are very used to children registering and coming through their door on the first day of school, and then they're their kids. So it's a little bit of a foreign concept to think, oh, I have all these kids out in the community now. I got to figure out how to coordinate services in the community. So that's where our service and support hubs has been very successful, is supporting schools doing those level of things, case management, IEP meetings. Oh, the other big one is in special education K through 12, developmental delay is an eligibility category that we're always trying to get rid of in kindergarten year because it ends. But it is one that we definitely want to look at and explore in this age group, 3, 4, and 5. And so school districts really needed some hand holding with learning how to do the BDI or the DAC and how to talk about developmental delay in IEP meetings and eligibility meetings. So those were some other areas that were very foreign to them. Okay, I'm going to stop sharing. Just know that this slide has it has my contact information. Erin Fraser is my director. And then Megan Welter is our associate commissioner at the Department of Education. And Jen, can you please put your email in the chat? Okay. All right. I'm feeling like I will not have enough time to answer all the questions in the chat, but what we do is we'll get a printout of this. I'd like to leave the last 5 minutes for anyone who wants to unmute and ask questions or comments. Did I give you the information that you needed? Is there anything more that you want to learn about? Don't be shy.
Sandy, can I ask a question?
Sure.
So I'm wondering if each district is able to set their own rate, how are we making sure that those lower income towns are going to be able to get a contract?
So play that out for me a little bit so I understand.
Yeah. So I work at a private pediatric clinic.
Okay.
And we are contracted with CDS. We go to all kinds of developmental preschools, daycares, what have you. And so if we're now contracting with different towns as a business, why would I contract with a town who's going to pay me $10 an hour when I can go to one that's going to pay me $50 an hour? So what is going to help make sure that those towns are served to the same capacity?
Yeah, I don't think I have an answer for you because contracting is a local control decision at each school district. We can't tell them, we can give them the CDS rate sheets, and that they have asked for that. They've asked for that for a couple reasons. They want to know kind of what providers get paid. But all school districts, or I should say most school districts, already contract with speech, OT, PT. So they should have some sort of general idea what they're paying their people. And or if they don't, they're probably going to ask, right? Like, what do you charge?
Mm-hmm.
And then go from there. It's a negotiation process.
Yeah, it seems unfortunate. I know when we talked with the commissioner last year, one of the things we said was that the state should set a flat rate to make sure that all districts and all children are going to get, high quality support services.
Yes, but if you know anything about Commissioner and the state of Maine, it's very big on local control. And I know that even as a former special education director, I had different contracts with different providers,
Mhm.
depending on how that was negotiated, how long they had worked for me, what their credentials were. So there was many different factors that go into contracting with providers. So, and I feel like the other thing is that we hear in CDS a lot is that the standard rate is a problem sometimes for folks throughout
Oh
the
yeah,
state.
it's much, much lower than what private insurance pays us, that's for sure.
Right. And we really don't want to be in that game, I guess, at the
Yeah.
Department of Education of like negotiating or figuring out rate setting. We do it
Mhm.
with special purpose pre-K programs and special purpose programs, and that's difficult enough to do the cost analysis and set the rates and then all of that.
Sure.
So.
Okay. Thank you.
We have two hands up, so hopefully we can get through them in the next 2 minutes.
Okay.
Ruth, if you'd like to go ahead.
Yep, real quick, back to the 2A2B. Is there a deadline date for that? Is it also the July 1st, 2028 to get it?
There's not a deadline, but know that what happens is that when school districts get monitored through the monitoring process, they will look at certification and licensing. So they will say, okay, school district in cohort 2, you have contracts with these providers. Show me your contract, show me their certification, show me who's providing special education services to those students.
Okay, but CDS isn't gonna require that right now. They're just waiting until the schools take it over, depending on the district.
I don't have an answer for that.
All right, and Rebecca has a question.
Yes. Hi, thanks. I provide services in one of the cohort 2 district areas, Topsom, and I'm wondering about the timeline for that. And maybe you already said, but would the services transition to the cohort 2 districts as of like next fall, or for planning purposes and contracting purposes? What are we looking at for timelines for those of us serving cohort 2?
That is a great question. And we just decided that last night at like 5:30. So, and we're pushing it out to cohort 2 schools today, but it will be the first day of school for that district, which is what we did for cohort 1 as well.
Thank you.
Yep. That is news, hot news. You guys get it first.
I will take the questions from the chat that we may not have answered, and we'll put them together and try to answer some of the questions as well as we move forward if they seem to be different than what we already discussed.
And I will stay on for a few more minutes if anyone has any other burning questions that they want answered right now. But if not, this is recorded and we will be posting it and sharing the slide deck with you. And I thank you all for coming. I know you're all super busy. It was great to see some faces today that I haven't seen in a while. Take care.